patient. So, kailangan medyo mataas ito. Then, kailangan ganito. So, proper exposure. Ang importante natin for the cardiovascular is your precordial area. Itong area na ito. So, we do your inspection. You check for any bulgings, any depression. Okay, so negative bulging, no depression. Tapos, you check for the PMI and for the apex beat. So kung hindi mo makita dito, you can go to the other side and try to check for the PMI or the apex beat. Pwedeng apex beat na lang kung yun ang gawin yung PMI. So apex beat located at the 5th intercostal space, left mid-clavicular line. Okay, so no bulgings, no depressions. Okay, then you check for the neck veins. Visible neck vein engorgement is wala neck vein engorgement. Sino may ruler? Sa lecture nyo, ano nakalagay na normal na JVP sa inyo? 9? Kasi sa Bates, less than 9 ang nakalagay eh. At sabi nila hindi daw, sabi nung iba...
Pag from the right 8 yung 3 to 4. 3 to 4 na 8 to 9.
Oh, di ba nagpa-plus 5?
Apo.
Kung ano yung value, di ba plus 5 pa. Kaya ang normal should be below 9. Diba? Tsaka yun na nakalagay sa Bates. Ang sinusunod natin yung Bates. So isasabihin nyo na lang na 3 to 4, ano ba, 3 to 4 centimeters, then you add 5 to get the actual value of the JVP. Okay, so for your JVP, you get the angle of Louis, sternal angle of Louis. Then you put your centimeter ruler there. And then this one is to kung asan yung site of highest pulsation. Ask the patient to turn to the side. And then you get the actual position of your pwedeng ganon. Basta kung saan yung pinaka-meniscus ng kanyang highest pulsation of the neck. So, halimbawa, 3 to 4, 3 centimeter water. Okay? So, after that, you also check if there's any visible carotid pulsation. Wala namang carotid pulsation tayo nakikita. Then we do your palpation. So palpation, you palpate the different areas. So this is your aortic area. So palpate muna natin. So this is your, so ito yung angle of Louis natin, di ba? So you go laterally. That's your second intercostal space. So this is your aortic area, second intercostal space, right parasternal area. Then opposite to that is your pulmonic, then your Erb's point, then your tricuspid area, and then your mitral area. So you palpate. If there's any lift, any thrills, tips, okay. Then you can also use your ganon. Okay, then if you feel anything, you will report it as presence of lift, thrills, or hips. Anong area. Then after that, you also do you palpate for your carotid arteries. So never palpate at the same time because it can cause the dropping of your blood pressure. Kung minsan nagkakos ng syncope. Yan. So you should be able to palpate. So one side after the other. So that is for your palpation. So, yung part of your palpation, you also palpate for the apex beat. So, papaturn nyo sa side, and then you palpate for the apex beat. Kung hindi nyo nakita, kung hindi visible during inspection. Then after that, you do your auscultation. Auscultation, you first do your inching using your diaphragm, then after that you use your bell. So for high frequency sounds, for S1, S2, S3, S4, you use your bell. Pati murmurs, you also use your diaphragm. So, hindi nyo na masasabihin nyo sa pasyente na hinga lang na normal. Huwag hihinga malalim. Kasi pag pinahinga nyo malalim, yung breath sounds na maririnig nyo. Okay? So, go inch by inch. Tapos, shift to diaphragm. Ganun rin, inch per inch. Okay? Then you auscultate for carotid brewing. So, pagdating nyo dito pala, pagka nag-auscultate kayo using your diaphragm, you can count your rate. Pag sinabi nung preceptor na, or tanungin nyo na, do I need to count the rate? To count the rate. So, pagdating nyo dito sa mitral area, tsaka kayo magbilang ng rate. Okay, after nun, so, yun na. So, you report it as S1 is heard best at the apex, S2 heard best at the base. Tapos, no murmurs, negative S3, negative S4, no carotid brewing. Okay?
Okay na kayo magtanong?
Sino magtatanong? Tayo magtatanong?
Yung mga ganun, do I need to?
Okay lang. Gawin nyo, tapos tanongin nyo doon. Doktor, kailangan ko pa po bibilangin ko pa po ba yan? Pag sinabi nila bahala ka, gawin mo na lang. Gawin mo na lang. Pag sinabing bahala ka, kung anong gusto mong gawin, gawin mo na lang. Basta make sure you are within time.
Mabilis na yung cardio.
Okay, after that, you palpate the pulses. So, since hindi na kailangan dito sa carotid, tingnan natin. So, you palpate the brachials. So, brachial artery is always at the medial aspect, don't forget. Radial, at the lateral, at the side of the thumb. Okay? And then popliteal, you have to bend the patient's knee and palpate. There. And your dorsalis pedis here. Yung iba dito pinapalpate. Hindi. Dito. So, magkabilang side yun. Okay? Any more question? Kaya-kaya na.
Kakayanin.
Kaya-kaya na.